Hi, my name is Yuen and I'm a PhD student at the National Drug and Alcohol Research Centre. I'll be providing a brief overview of a study that examines patterns of transitioning across physiological and psychosocial alcohol-related harms in adolescence. First, some disclosures of interest, acknowledgements, and funding information for this study. Alcohol-related harms cover a wide variety of negative consequences that can be classified into different dimensions. The physiological dimension, which includes experiences such as hangovers or vomiting, and the psychosocial dimension, which includes experiences such as getting into a fight or having your personal relationships impacted by drinking. We used data from a cohort of 1,828 young Australians to examine whether a variety of adolescent, parent, and peer factors at age 13 were associated with patterns of transitioning across physiological and psychosocial alcohol-related harms between ages 15, 17, and 19, and then whether these patterns of harm were associated with self-reported symptoms of alcohol use disorder at age 20. We found 5 main patterns of alcohol-related harm in our cohort. The no harms pattern, where participants did not experience any harms. The late escalation to physiological harms pattern, where participants did not experience any harms until age 19, where they then reported experiencing physiological harms such as having a blackout. The early escalation to physiological harms pattern, where participants did not experience any harms at age 15 but experienced physiological harms at ages 17 and 19. The late escalation to all harms pattern, where participants did not experience any harms until age 19, where they experienced physiological and also psychosocial harms, such as getting into a fight. And finally, the gradual escalation to all harms pattern, where participants escalated from no harms to physiological harms to all harms across the 3 time points. The pattern experienced by the largest number of participants was the late escalation to physiological harms pattern, so we chose this as our comparison for all subsequent analyses. Some of our key findings that parents and caregivers of adolescents should take note of is that adolescents who are female and adolescents with more substance-using peers at age 13 were at greater risk of experiencing early physiological harms. And importantly, the combined experience of physiological and psychosocial harms in late adolescence predicted meeting DSM-5 criteria for alcohol use disorder at age 20. However, this is not a formal diagnosis, but rather an indicator of potential clinical problems related to alcohol use. Thanks for your time, and for more information, please feel free to contact me using these details.